Hello everyone, my name is Seher Ali Khan. I am a GP with an extended role in dermatology and a sessional GP in Leeds. Today I'd like to talk to you about scabies and some pathway updates for ivermectin. Scabies is a parasitic infestation of mites that causes an intensely itchy rash. It's highly contagious and it's passed between people by skin-to-skin contact. Recently, there has been a huge surge in the UK, especially in schools and universities, and it's becoming a big public health issue. In terms of the life cycle of the scabies mite, the scabies eggs hatch within 3 to 4 days after being laid by the female mites in the skin. Then the eggs develop into larvae, which then mature into adult mites within 1 to 2 weeks. We've seen a national shortage of topical permethrin and malathion. And there has been a significant increase in patients presenting to primary care with treatment failure with topical permethrin, and this may be due to emerging resistance. Moving on to diagnosis, patients usually present with a generalised rash with erythema, papules and urticated lesions, and these are caused by an allergy to the mite and the products of the mite, and it takes weeks to develop. We commonly see burrows, and these are on the sides of the fingers, the webs, the borders of the hands, the wrists, and the feet. Often we can also see papules and nodules, and when they're on the shaft of the penis, they can be pathognomonic. Also, the groin and the armpits are also affected, and these persist for several weeks after eradication of the scabies mite. We see secondary impetiginization, which is relatively common, and often there are areas of pustules and crusting. In terms of distribution, the trunk and the limbs are the predominant site for most people. However, in elderly patients and immunocompromised patients, it can also affect the face and become very widespread. In infants, we often see papules and pustules on the palms and soles. The next slide demonstrates the scabies life cycle, and this shows the scabies mite going through 4 stages in its life cycle: egg to larvae to nymph, and then finally to adult. Dermoscopy is an excellent tool for identification of the scabies mite. When we apply a dermatoscope to the surface of the skin, we see these whitish curved or wavy burrows, and the mite itself is actually seen as a small brown sort of triangle or arrowhead. When we look at the bottom slide here, we can see that the mite is leaving a trail of feces and eggs in the burrow, and right at the end is the location of the mite. In the upper right slide, you can see these brown arrowheads, which indicate scabies mites. First line treatment for scabies is topical permethrin. It's important to treat all sites, including the face and scalp. And traditionally, we were taught to apply it from the neck downwards. However, recent evidence has shown it's more beneficial to apply it to the face and scalp, avoiding the eye area. Advise patients to leave this on for at least 24 hours, and they should apply it to dry skin and wait 5 to 10 minutes before putting their clothes on. If they are very symptomatic or they've failed prior treatment, they can reapply it after 12 hours. 1 course of permethrin equals 2 treatments, 7 days apart for the index patient and symptomatic household members. Please advise patients to wash all their bedding, and this includes soft toys and furnishings, on the morning after treatment, or exit the house for 3 days. Itch will continue for some patients for up to 4 to 6 weeks. I tend to offer either a topical steroid such as Umivate or mometasone, depending on the severity of any dermatitis that's present, or even Dermacool to take the heat out of the itch. Ivermectin has now been reclassified and is green light in West Yorkshire for classical scabies and for patients that weigh more than 15 kilograms. The criteria includes patients who've got ongoing signs of scabies infestation, and they have had 2 courses of topical permethrin treatment. So that's 2 lots of 2 times 7 days. We can prescribe ivermectin to patients who weigh more than 15 kilograms, and the dose is based on weight and not age. No blood monitoring is required, and ivermectin is generally very well tolerated. Contraindications include pregnancy and infants that weigh less than 15 kilograms. This is a really helpful ivermectin table that I use in my day-to-day practice, which lists the body weight on the left side. At day 0, you give them a stat dose, and then a second dose after 10 to 14 days. Treatment of close contacts is extremely important. By this, I mean anyone living in the same household, partners, co-parenting families, and others with significant contact, such as grandparents. Contacts infected with scabies may remain asymptomatic for several weeks. If we can recall the life cycle of these scabies mite, this makes sense. And contacts treated with ivermectin should be treated with permethrin unless they're assessed on an individual basis that ivermectin should be used. In practice, this means that patients registered at your practice within the same household, if they are asymptomatic, they require one treatment, and if they are symptomatic, they require retreatment after 2 weeks. Please signpost patients to the BAD patient information leaflet on scabies, which gives lots of practical advice and is very helpful. Please request advice and guidance if there is any diagnostic uncertainty or there is failure to respond to adequate treatment of the patient and their contacts, or infants under 2 months old or weight less than 15 kilograms. Thank you for listening. If you have any questions or would like any training or support, please email me at seheraliKhan@nhs.net. And if you'd like to provide any feedback, please scan the QR code on screen. Thank you.